My name is Sally Ayesa, and we are going to be introducing ourselves to intrinsic roles today. This is all about professionalism in radiology, and this is of particular focus for our Australian and New Zealand trainees, that it is part of their learning outcomes and curriculum. However, professionalism in radiology is something that is so important for every clinical radiologist around the world. So hopefully you find something valuable here. So we're going to start with a question. What do you think makes a good doctor? Better yet, what do you think makes a good radiologist? And what does good even really mean? So I've done a bit of a brainstorm here. There's lots of things that could make somebody a, in quotes, good radiologist. I put patient-focused in blue because patients should be at the center of all we do. But a radiologist also needs to be safe in their practice and their procedural skills. They need to be knowledgeable, efficient, culturally aware and culturally sensitive. They need to work well in a team. They need to be approachable if you need to ask them a question or to gain advice. They need to be interested in what they are doing so that they can be dedicated to lifelong learning and the process of evaluating themselves. They need to be responsible, kind and empathetic. They need to be engaged. All of these things are so important. But given how important all of these skills are, we have to ask ourselves, how do we assess this in our radiology trainees? So when I think about these skills, I break them down into three broad buckets. Knowledge is the foundation. You will come into radiology with knowledge from your medical degree and your studies so far, and probably your preparation for radiology training. This will be examined through physics and anatomy exams, and it will be tested in your latter stages of training through radiodiagnosis exams, where we test your interpretation, observations, and management of patients. As radiologists are not only diagnostic, but also procedural professionals, they need to have important practical skills. They need to be able to interact with patients while they are performing imaging-guided procedures, and they need to be able to do this safely while acknowledging their limitations. The third bucket is the professional skills, and these can be a little bit more fluffy and amorphous in their nature, and they can be a little bit trickier to quantify and examine. So we need to think of them a little bit differently. As part of the new enhanced radiology training program for Australian and New Zealand radiology trainees, professional skills are classified under intrinsic roles. And these are divided into 7 broad sections. That is communicator, collaborator, leader, health advocate, professional, scholar, and cultural competency. Broadly based on the CanMEDS framework, with the addition of cultural competency, the college has prescribed these domains to give a bit of structure to the learning of these professional skills and also ultimately allow their assessment. So the day that you walk out into the world as a qualified radiologist, us as your trainers know that we have done our best to prepare you for all of these such important facets of what it means to be a professional. So let's briefly look at what is within each domain. We won't go through everything in detail because that would just be far too much, and we'll aim to get to more of the nitty-gritty in some future sessions. Firstly, communication. And so this is broken into 3 parts. The first part, which is so important, is about establishing rapport with our patients. And the second 2 parts is about the specific communication, not only with patients, but also within our teams and communication with our colleagues. Medicine is a specialty which requires a lot of work with others. It requires you to function successfully within a team, which leads us exactly on to our second domain, which is collaboration. And the first section is working with others. The second is contribution to multidisciplinary teams. The third, for when things aren't going so well, which is conflict management and resolution. And the fourth, which is really important to our patient care, is maintenance of handover. You'll already notice that there's a lot of overlap. You can't have good collaboration without effective communication. So all of these intrinsic roles work together. For our radiology leaders, we want to see that they have knowledge of improvement of service delivery, the healthcare resources that we work within. We want to see our trainees develop leadership skills over the 5 years that they are training. And we also want to equip them with skills for managing career and practice. Part of being a professional radiologist is also about being an advocate. We want to train radiologists who have a strong moral compass and have the ability to advocate on behalf of individual patients as well as the community, and within that, the radiology community. Professional skills are considered as they apply to individual patients, but also commitment to the profession. You are part of a large body of radiology trainees and fellows across Australia and New Zealand, which is part of a group around the world. We work together to make our profession better. Scholar intrinsically is all about those skills that you need to be an effective learner and user of evidence-based medicine. Also taking into account is the research skills that we need you to gain during the training program to allow you not only to interact with that evidence-based research, but also contribute to the body of research and the body of evidence which we use to base our practice. This isn't just about pumping out papers, it's about being able to partake in the audit process, to understand what it is to work safely within guidelines, and to reflect on our own practice. Finally, cultural awareness and safety. And this is so important in any healthcare setting around the world. We are a diverse population of radiologists who service a diverse population of patients. And within that diverse population of patients, there are culturally vulnerable groups. That includes Indigenous patients. It includes our LGBTQ+ patients. It includes those who are racially or ethnically diverse as well. So let's finish up by thinking about intrinsic skill building. And you may think, well, look, this all just sounds like stuff I can get on the job. And you're partly right. But there is much more to this than you will be able to get in daily practice. It's similar to how you build your radiodiagnosis knowledge. Yes, it's so important that you report scans and you learn on the job and you engage and you listen to your tutors, but you also need to go home and read up on the side. You need to fill the gaps, and it's exactly the same for learning these intrinsic skills. So a few ideas. We've got that on-the-job experience and learning, and the same as anything, the more you engage, the more you put yourself out there, the more you go to audit meetings, participate in multidisciplinary team meetings, the more you collaborate with your colleagues, the more you participate in quality assurance initiatives and research, the better your intrinsic skill building will be. To back this up, there are lots of resources, and these include hospital, state, country, global guidelines on how to interact in certain scenarios, how to perform audits, how to perform research. There are peer-reviewed articles, and there are so many sources of evidence-based medicine for these professional skills based on qualitative research, review, input from other fields. You can go to tutorials, you can watch lectures like this one and the series to follow. You can undergo training modules, for example, those that are listed on the RANZCR website for cultural safety. And for those, I'll pop a link down in the description. There are podcasts. There are so many different ways that you can engage here, and so many different ways to learn. So my advice is to treat intrinsic roles like you would any other subject that you're studying. Anatomy, physics, radiodiagnosis. Throw yourself into on-the-job learning. Be part of the communities in which you serve. Consider your professionalism, reflect, but also take the time to look up that evidence and to build your skills. Believe me, you'll be a better radiologist for it.